Pandemic flu is the subject for this program. When one strikes, it is highly contagious. There is no vaccine. Thousands die, and dire circumstances occur in daily life and commerce. Stay tuned to learn how to protect and care for yourself and your family.
Welcome to The Better Part, a program by and for seniors and devoted to exploring the many facets of those better years of our lives. The name of our program is inspired by a quotation from Robert Browning. "Grow old along with me, the best is yet to be, the last of life for which the first was made." Now, sit back and enjoy a program made especially to provide seniors with useful information, plus some lighter moments to brighten your day.
Our guest is Marsha Hovey, Disaster Prevention Coordinator for the City of Cupertino. She's actually employed by the Santa Clara County Fire Department. It's nice to have you here again, Marsha.
Nice to be back.
Even though the swine flu has struck, fortunately not as bad as it might have, it does continue on for about 18 months, doesn't it? So first of all, would you tell us the difference between pandemic flu, a flu epidemic, and regular flu?
Okay, well, the regular flu is something that we've had before, that it's been around for a while, and that's why we have flu vaccines for those. The most common strains are put into the flu shots that we get every year, and that's why we get our flu shots to keep our immunity up and make sure that we don't have a widespread pandemic or an epidemic of those traditional flus that we get every year. Now, an epidemic, it's getting bigger, and I probably don't have an official definition for that. But pandemic has to do with the fact of how far it is spread. And a pandemic is when it has reached a certain percentage of the countries in the world.
It would be world.
Right, it's a worldwide event, and it doesn't have anything to do with the severity. But I think that the thing that was interesting with this flu and what's happened with it so far is that it really did show us how quickly a disease can be spread, because our populations move about the world so fast now.
Well, we get our food from China and all different places, and all the commerce that's going and coming in on the ships, the germs and so forth that are brought in. The swine flu is the one we're talking about right now, the H1N1.
Right.
How does it go from an animal to, like the bird flu and the swine flu, how does it transfer to people?
Well, and that's the interesting thing, that both the bird flu and the swine flu, they just mutate. Eventually, people that are around the birds or around the pigs very closely can actually contract the swine flu directly from the pig. And then what happens is, for some people, when they get the illness, they actually have it mutate in their body, and so they can transmit it to another human, and that's when it becomes dangerous. The birds and the pigs have these germs all the time.
Why is it's so contagious?
Well, because we've never had it before, and the strain, that's part of the definition of why it would become a pandemic, is because it's a strain of flu that no human has ever had. Now, there has been some discussion that this H1N1 specific classification may have been around before, that some of us may have some immunity to it, and that might be why it's reacting the way it is right now. But typically, a flu that no one has had before, everyone's going to get it. I mean, we get germs that we've never had before our whole life, and we build up an immunity over our lifetime. And so when something new occurs, we're going to get it.
I was wondering about developing the vaccine. Now, at what point are they able to determine that it's a new type flu and begin working on the vaccines?
Well, unfortunately, unless you are testing even testing the pigs, you can't create a vaccine from the pigs. You have to create a vaccine that is related to the human interaction of the germ. And so they can't really work on a vaccine until they've found that human infection and been able to work on it for about 6 months. So until we found human cases, which is what happened in Mexico, then they took blood samples from them and studied that and began the development of a vaccine. Now, the vaccine will only work if the flu stays in its current configuration. If it decides to mutate, and it can, that's what's happened with the other flus that have turned into pandemics over the course of the last 100 years, that vaccine may not work, and we'll have another 6-month waiting period while we're developing the vaccine. And then once it's developed, it takes several months to produce the quantities that we would need to get it to everyone in the world.
What are the symptoms of this flu?
It's just like a regular flu. If imagine the worst flu you've ever had in your life, where you have a high fever, you're bedridden, you're vomiting, you have diarrhea, you just feel awful. Aches and pains all over.
Coughing?
And then it'll turn into a cough. So, you get over the basic symptoms, and then you may have congestion in your throat and your lungs. Some people may end up getting pneumonia because they haven't been able to keep their lungs clear, and a cough that lasts for a long time that, you just can't stop it. Do you remember those kind of colds?
Oh, yes.
Sure. Well, this is just like that, and so our treatment of it will be just like that. The scary part about this type of flu, though, is if we all get sick at once, and then we aren't able to keep our lungs from being congested, if we can't proactively keep that from happening, then we all end up needing to go to the hospital at the same time, and the hospital can't manage that.
Yeah. Now, how long do the symptoms last?
You will be sick about 14 days, and then it'll probably take you another 14 days to get your strength back and have the cough start to go away.
Who determines when it is a pandemic?
The World Health Organization makes that determination as they monitor where it's spreading. They keep track of what countries it's in, and then they raise the threat level, essentially, and you can go to the World Health Organization website to see what the currently it's at level 6. That's the highest level. That means it's a full-blown pandemic, which means that it's spreading all over the world. It doesn't mean that people are dying. It just means that it's spreading all over.
Does going from like level 1 to level 6, how long does it take to go from one level to another?
Well, when we first heard about the Mexico infection and people dying there, we went from a level 1 to a level 5, I think in 5 or 7 days.
That was based upon the rapidity of people contracting it?
As soon as they were detecting it in different countries, they knew that it was, it looked very powerful initially because so many people in Mexico died. We really thought it was going to be the worst case scenario.
Are all doctors required to report when someone comes in with the flu?
There are mechanisms in place, and I'm not sure if they're in every hospital and clinic. I know that the public health departments in all of the counties are working very hard to make sure that there is a reliable reporting system in place. There was a lot of new ground that was broken during the pandemic as even small clinics were having to do testing for H5N1 or H1N1 and get those samples in to be tested. So there's a lot more coordination now. It was a good thing from that standpoint that we actually are better communicating now.
So if you went to your local doctor and you had the flu, and he determines that you have the flu, he might or he might not report it to these clinics who do the testing, and he doesn't do any testing. A local doctor would.
Well, and we're not doing the testing anymore because we know that the flu's here, and knowing that it's here is about all we can do with that information. So to continue to test every single patient, we were actually ending up with more people going to the hospital because they thought they might have it and wanted to be tested. So it was almost creating more work. People were more afraid.
So we don't really know how many people actually had it. We only hear about.
Right. And people are still getting it. Napa, they had just announced last week that Napa had found a case. So it's still here. It's not gone. We just are now treating it as if we have some common cold or flu because it didn't get as serious as we thought it was going to be.
And I read somewhere, either you told me at a previous time, that one of the reasons it's so contagious is that a person doesn't show symptoms for about 2 days. So if you're with a person during that period, then you can catch it too.
Yeah, and that is one of the tricky things about this flu. You know, you don't know you have it when you're contagious. The first 2 days that you actually it's incubating in you, you are spreading the germs and no one knows. So that's why the hygiene component is so important, that we practice good hygiene. Don't put your fingers in your mouth, don't touch your eyes, keep your hands washed, use Purell or some other sanitizer, cough in your sleeve instead of in your hands. If you blow your nose, make sure you wash your hands right away. Better to use disposable Kleenex than a tissue that you're reusing. Because anything we can do to keep the germs from spreading, and the spread is human to human, by sneezing, by coughing, by touching something that someone else has touched who's just coughed and put their hand on the telephone, and now you picked up the telephone, and the germs will last for a day. They'll stay on the surface.
Now, are you and I, we're about 4 feet apart. Now, if you had it, would I catch it just from your breath coming through the air?
There's a term that's used when we really are trying to prevent the spread. It's called social distancing, and the social distancing is a little farther than 4 feet. It's 5 to 8 feet. Because if I did suddenly sneeze, I could project that out and you might inhale it.
Or if you laughed.
Laughing if I spit, yeah. But it's fluids that's going to pass it. So if we're this far apart and I'm not coughing or sneezing, you're probably okay. But if we were in that situation, we were in the grocery stores or places trying to pick up cold and flu medications, we'd want to actually be farther away, especially if you heard someone coughing or sneezing. You want to get away from them.
Some of the schools closed and some events were canceled, and some people complained later. They said, well, why did they make such a to-do? It wasn't as bad as they said it was going to be. But is it a good idea to go ahead and do that once?
Yes.
Maybe they prevented a lot more
Absolutely,
people from
they did. And they did exactly what we had planned to do. We've been planning for the worst case scenario pandemic for more than 5 years. And it's certainly a nightmare when you talk about, the whole world being infected. It sounds like a science fiction movie, but it's possible. And if you don't stop the spread as quickly as possible, it spreads. You saw how fast it spread with just this mild case. If it was something that was killing people, it would just be horrible if we pretended that it wasn't a big deal and let people get infected. So I'm happy that it wasn't killing people. Very happy. But, the public has to understand that public health has been studying this, and they don't want people to get sick. That's their role, to make sure that people stay healthy. And if that means that we have to close businesses or close schools, we have to trust that they're doing that. They wouldn't do it if they didn't think it was important.
Well, considering that the strain or whatever, the contagion can last for a year and a half, and it comes in waves of every 6 to 8 weeks, then we still have to be concerned. We can't say, well, it came and went, we closed the schools for nothing and all this, and now it's all over. We still need to be careful, don't we?
Right, it's still in the world. People are still getting sick. There are over 55,000 cases worldwide now. and I've lost track of the deaths. It's not a lot by comparison, but any death is significant if we could have prevented it. Mm-hmm. But yes, right now that the flu is in Australia, the Southern Hemisphere is in their flu season, and so what we're watching now, what the World Health Organization and the local public health departments and the local emergency managers are watching is what happens to it during Australia's flu season, because if it gets combined with another flu and turns into something that's more
ominous,
deadly, then it could come back here for our flu season, and it could look a lot worse. And so we can't stop it, but we can slow the spread, and slowing the spread is going to save lives. And it's
now something that you mentioned me too, that it's the people who don't ordinarily get flu shots that are the victims. More serious victims, mortality, and so forth. Why is that? It's just because they're young.
Well, we do think that everyone should get a flu shot, and the recommendations in recent years is all children, adults, everyone should get a flu shot. Because this new pandemic is out there, this new strain of virus is out there, it's even more important that people get flu shots, so that if you do get sick, you have a little bit of a clue that it's not your typical flu if you get that sick, because you won't get that sick if you had the flu shot and it was one of the strains that you were inoculated for. But this flu, because it is something that the body has to actively fight, it tends to be harder on the part of our generation that is the strongest. So it really targets, and this happened in the 1918 flu, it targets 18 to 35-year-olds who have the strongest immune systems. And there's a body process that's called the cytokine storm. It's probably the only medical term I know. It's a reaction, it's your body reacting and overreacting to this new germ, and it's trying to fight it. What it does is it weakens the immune system so much that the germ just takes over. And then you're prone to pneumonia, and then you are more likely to die, just because there are so many people with pneumonia that the hospitals can't treat them.
Well, I was going to ask you now, because in a hospital, there's only a certain section that's set off for contagious diseases. And you think, well, they bring people into the hospital with these diseases and they don't have room for them. They can't mingle them with the other people who don't have it. And what happens in hospitals when you got so many people coming in dying of these diseases, and maybe there are not enough doctors and nurses to go around to cope with it?
Well, in the worst case scenario, it's been modeled in Santa Clara County, and I'm sure it's been modeled in every county, that we've determined that based on the rate of the spread and the likelihood of people needing hospital care, how quickly our hospitals would be overwhelmed. And it would be in less than 2 weeks, our hospitals would not have any beds available to treat people that had respiratory problems. Now, if you have the flu and your typical flu, you're pretty sick, it doesn't mean you need to go to the hospital, because all the hospital's going to tell you to do is drink a lot of fluids, to drink something with electrolytes in it to keep your body hydrated, make sure that you take something to reduce congestion and minimize a cough, and get plenty of rest. And so they don't want people going to the hospital because they have the flu. They only want to see the people that are having complications of the flu, and the complications are typically because they didn't follow the medical directions. Or, in the case of the pandemic, when everybody ran off to the grocery store at the same time to buy the fever medications and the flu medications, they're all gone. So you end up not being able to treat your flu, and then you're just going to get sick.
You have no Tylenol to
imagine not having any Tylenol and just having your fever, have to monitor your fever with, cold washcloths and cloth baths. I mean, it's not a pretty picture, and it's so easy to prevent that.
Well, I would imagine then that the doctors and nurses could become ill as well.
Absolutely.
So they're understaffed. Not only do they have more patients, but they're understaffed. And do they have enough supplies in the hospital and equipment to cope with the severe illness?
No hospital has enough supplies to cope with it. They would start relying on federal stockpiles of materials. There are going to be severe disruptions. About a third of the workforce may be home at any one time because it's, going to go in waves, as you said, and it does last for 18 months. People are going to be very afraid to go outside because they don't want to get sick. They may have had a friend that died and they don't want to die. Now, just because you get it doesn't mean you're going to die, but why risk that? And so we're going to rely a lot on volunteers to help the hospitals. We have a medical reserve corps. There's a national medical reserve corps in a lot of individual cities and counties that have it, that are trying to tap into retired doctors and nurses or private practice doctors and nurses that can assist with basic care for people that are becoming seriously ill. We'll have to open up what in an earthquake could be a shelter. An earthquake shelter might turn out to be an influenza care center. And we would need someone to staff that, not just medical people, but others to help keep things clean and restock masks and make sure people are drinking enough water. It will definitely be a community event. We will all be working together to try to get through it.
And then I suppose, like the services, delivery trucks to grocery stores, if those people are sick, then the stores might not have all the food they need. And I'm thinking about public servants, police, fire department. I know that those people get shots before,
Right.
if they're available, because they have to, be able to take care of us. But if even the utilities people, I don't know how that would be effective. It seems like it could be
Right.
just.
Well, there are a lot of interesting moral issues about who gets the shots first. And when we talk about the service providers, the people that are delivering food to grocery stores or cold and flu medications to restock, the stores don't keep more than like a 3-day supply. They get deliveries ongoing. Now, if those truck drivers are afraid to go out because they don't want to get sick, or the other side of it is they can't afford to stay home. They are sick, but they need to be able to put food on their own table and take care of their families, so they go to work sick anyway. We're either going to not have the supplies, or the spread is just going to continue because people aren't isolating themselves. So, stockpiling food. I mean, we're getting back to bomb shelters almost, where we have to start thinking the way we did in the 50s, that we really have to be able to be self-sufficient for a period of time because our service providers may not be there. I would guess that, police and fire may get the vaccines first, but I think there probably will have to be more of a thought on, who's going to provide the greatest good?
Trash collectors,
Yes.
for one thing.
Yes, I mean, everyone, I think we could probably justify everyone is important, and every job from trash collector, to the county executive are important for different reasons.
Well, I know one of the things that you were telling me is when you're taking care of people at home, you should wear a mask. Not a painter's mask, but one of the masks that there's a name for it, I think.
It has a classification, an N95.
N95 that you use, and rubber gloves. And then if you can, have a supply of paper towels and throwaway dishes. And then living in earthquake country anyway, we always try to keep a little food on hand. So should they keep like Jell-O and chicken soup and...
Well,
you mentioned earlier,
our
Pedialyte.
county public health department has put out a flyer that they actually put out when we were talking more about H5N1, but it all applies, and it's called Preparing for the Pandemic, and it's pretty comprehensive. It talks about what supplies you should have. It's also on the internet. There's a lot of information on the internet about what what you should do to care for someone at home, the best precautions to keep things from becoming infected, and making sure that you clean all the surfaces. But the health department has this, and they do talk about supplies. Most of the time when they're discussing supplies, they're talking about after you've had the flu, and the fact that we may not be able to get things at the grocery stores because supply chains have been disrupted. And so they're talking about, your basic earthquake supplies, canned food and rice and beans, anything that has a long shelf life. But what is not mentioned is, what do you do when you're sick? And so you do need to have Jell-O, a 7-Up, or whatever your home remedies are, whatever you do to take care of yourself and feed yourself when you're sick, you should have on hand all the time, because you may not be able to get them at the store if it's the same home remedy everybody else uses.
Well, there are some places where you can track the status of the flu, the epidemic. And what are do you know some of those numbers that you can give us?
The World Health Organization, if you search for World Health Organization, I think it's WHO.int, it's like World Health Organization.international. But they have a listing, the most current information on how many cases there are, where it is struck, how many deaths there have been, and we've been lucky so far that it's not been too bad. There are other good websites, though. The pandemicflu.gov is full of good preparedness information. The public health website for Santa Clara County, which is SCCPHD, Santa Clara County Public Health Department.org, also has a lot of good information. And then your local city should be able to provide you some information too.
Well, thanks so much for coming back. And
my pleasure.
I hope that we don't have a terrible disaster, and it looks like, at least on your part, you're trying to take care of us.
Well, and we've got to take care of ourselves. So,
I
hope everyone just remembers.
Be prepared.
Cough in your sleeve, sneeze into a tissue, wash your hands, and we will prevent the spread. We can reduce the impact.
Well, thanks again.
You're welcome.
We're happy you joined us for this program. If you have ideas for programs, subjects you would like us to discuss, you can reach us through the Cupertino Senior Center. It's 408-777-3150. We also have a website. It's www.thebetterpart.com. We have forms on our website that you can order programs that we have available, and we also have some shows at the Santa Clara County Library System that can be checked out. So thanks again, and we hope to see you next time.